Um, Today we will be, our topic today will be asbestos, lead, and mold. Mainly we're looking at, some basics about what asbestos, lead, and mold are and how we would assess these items, during sampling analysis and what we would do during remediation projects. For asbestos, we're going to look at the, different classifications of asbestos-containing materials, health effects, talk about our New York State Code Rule 56, which is the primary regulation that dictates how we do asbestos abatement and control here in New York State. We'll also look at what the federal regulations are that pertain to asbestos-containing materials. And we'll also discuss some sampling and abatement items. Lead, we'll take a look at regulations, see what's out there, and concerns for how to abate and remediate a project and mitigate lead hazards that you may have in a building. And then finally, mold, we'll talk about our current legislation that was passed for New York State, Article 32 of the New York State Labor Law, that pertains to how we do, the requirements for assessing and remediating mold on a mold-related project here in New York State. And we'll get into some different control methods on what to do when you do have a mold issue. So just to get kick-started on the asbestos-containing materials, the DOL, New York State Department of Labor, and the EPA, their definition of asbestos-containing materials, anything that has greater than 1% by weight of asbestos. And there are certain fibers, types of fibers that are regulated under that definition. There are 6 different types that we have regulated. There are other types that are closely resemble asbestos, but they're not part of the regulations and are not included as far as defining the material as asbestos-containing material. So it's kind of interesting to know that you do have certain types that's regulated as asbestos, but you have other fibers that we've found over time that mirrors or has very similar characteristics as asbestos fibers, but they're not regulated. So if you could imagine, there's some materials out there that probably have those, and it's good to know, regardless of whether you're dealing with asbestos-containing materials, when you're demoing and you're removing materials and you're breaking them up and such, that it should take caution regardless. Any type of dust could be harmful dust. On the flip side of what we define as asbestos-containing materials from DOL and EPA perspective, OSHA, they mainly perceive asbestos-containing materials as, they regulate their asbestos materials as anything with a detectable concentration of asbestos. So if you're under that 1% threshold, they still would indicate that their regulations for worker protection do still apply in those scenarios. So when you're working on a project, you're not necessarily required to do abatement per EPA and DOL requirements, but you may have some protocol that you have to follow to meet OSHA requirements for worker safety. Some different forms of asbestos-containing materials. We have the two main categories of friable and non-friable. And what I mean by friable is you could take a material, you can crush, you can pulverize it just by normal hand pressure. So if you take a look at that picture there, the fireproofing, obviously you could go up to that, you could pull a piece of that fireproofing off, and you can really easily crumble it. So that's a highly friable material. Your other friable materials, your insulations, sealant tile would be considered a friable material if it had asbestos. So those things, as you can imagine, are very easily released into the environment or into the air, the surrounding air. So those are a more critical concern when it comes to how to handle and abate it and how to manage it inside a building. The non-friable materials, those are those materials that you can't, just pick up and easily crumble and pulverize and release the asbestos fibers. So your floor tiles, your adhesives, your mastics, things like that. Those asbestos fibers are pretty well bound up in that material. So it takes a little bit of effort to get them to release, just by, probably pulling up a floor tile off the floor, really isn't going to be an exposure concern, even though it is a regulated abatement if you do that. The non-friable organically bound, those are non-friable materials that, again, they're bound in an asphaltic or vinyl matrix. So it becomes even more difficult to release those fibers. As you would look at, outside of New York State on the federal requirements for abatement through the EPA, they don't have as much stringent requirements on those non-friable and non-friable organically bound materials. You can do work a lot more easily in those areas outside of New York State. Here in New York, we treat all ACM as requiring abatement, and so regardless if you're friable, non-friable, we're abating it here in New York State under the Code Rule 56 requirements. On the EPA side of things, they have some additional definitions as far as types of ACM, specific materials, and that would be surfacing, thermal system insulation, and miscellaneous materials. Surfacing, anything that you would trowel on, spray on, so your fireproofing, your plasters that you trowel on, acoustic sealing materials, your popcorn sealing type materials, those are surfacing materials. Your thermal system insulations, those are quite simply anything used to keep hot things hot or cold things cold. Those pipe insulation, boiler breachings, that's all thermal system insulation. And then the last category being miscellaneous is the category with the most different types of materials in it, floor tiles, mastic, anything else that doesn't apply to those first two categories. Again, in New York State, we don't pay, it's not critical what type of ACM you're dealing with. We're abating all of it under proper protocol. But on the federal side, there are some differences with how you handle and manage surfacing, TSI, and miscellaneous materials. One thing, on the sampling end is, surfacing materials, TSI, we're doing more rigorous samples, more samples than we conventionally would for miscellaneous materials, and that falls in line with the HERA regulations and other federal protocol. So exposure to asbestos, the obvious one is inhalation. We all have heard of the, seen the commercials about mesothelioma, asbestosis, getting assistance with those cases if you've had exposure. And we've all probably heard of some cases of people that have had damaging effects from asbestos exposure, and generally it is the inhalation exposure. It affects your respiratory tract, causes all sorts of problems, and usually is going to be fatal if you contract that disease associated with it. The other less common exposure pathway would be ingestion. There have been cases with stomach cancers and such that were attributed to, or likely attributed to, asbestos exposure. And this is primarily in the form of like a drinking water system where you have asbestos-containing pipes in the system, and there's high concentrations of those asbestos fibers, but could also be something that gets through aspiration or something. You ingest those materials that through the breathing process too. Health effects and these are mainly related to your inhalation exposure, and that three main things that are the serious health effects are asbestosis, lung cancer, mesothelioma. Asbestosis is the scarring of the lungs from fibers getting deep into the lung system. They pass through all our natural defense mechanisms right into the lungs, and when they get there, your body reacts to it negatively, sees it as a foreign substance, and it attacks it. So you got white blood cells, accumulating, attacking, these fibers, and unfortunately, the body can't. Usually, once they get embedded in the lungs, they can't repel these fibers. They can't pull them out and discard them. So you got those fibers stuck in there, and the body keeps reacting and reacting and reacting. That just leads to scarring and build up of scar tissue. And build up of scar tissue in the lungs is not a good thing, because that affects your breathing and seriously restricts your air passageways. Lung cancer, tumor, and this is similar to what you could get from smoking or other indoor or outdoor hazardous air pollutants. So the one thing with lung cancer is you aren't necessarily able to attribute it specifically to asbestos exposure. So it's a little bit harder case to show that you got lung cancer and it is because of asbestos exposure. There's so many other things that could cause it. So it's a harder case to fight, you know, for the cause of it. Mesothelioma, on the other hand, is pretty much a done deal. That's asbestos exposure, and that's why you see the commercials primarily focusing on mesothelioma, because the lawyers know that they can definitively attribute to asbestos exposure, and then they can look at the history. Okay, well, where would this have occurred? In employment, place of employment, a place of you know, school, whatever, you know, you might have the exposure, and that's who they can target for those claims. So that's why you see a lot, you know, those commercials are focused a lot on that mesothelioma. Unfortunately, with mesothelioma, it is the most deadliest of those, and um, once you do get diagnosed with mesothelioma, it's a very short lifespan after that. So there are the lawyers looking for the cases for it, but you're not going to reap the benefits. Your family members will, but it's usually you know, within a year you're probably not going to survive. Regulations on the federal side, there's three main ones that we deal with at HERA, and that's primarily dealing with K through 12 schools. So this was usually at the forefront of asbestos regulations when they became a big thing in the 1980s. And this dictates how things are managed in K through 12 schools. It requires all public and private K through 12 schools to develop an operations and maintenance plan that identifies your ACM in your school, or you know, make sure it's in decent and in a suitable condition. It does primarily focus on the friable asbestos-containing materials in ones that are exposed. So it doesn't identify. It's not intended to go through and identify every asbestos-containing material in the school. So when you're looking at a HERA plan at a school, just don't be of the mindset that it's going to identify everywhere the asbestos is. There's still going to be things that you need to do to assess that prior to renovations or other repair activities. NESHAPs, the National Emission Standards for Hazardous Air Pollutants. This covers asbestos along with a lot of other air pollutants that are out there. So there is a specific section that deals with asbestos, and in this section we'll get into requirements as far as handling and abatement and control of ACM. So it talks about notification procedures to notify EPA. On the state level, there's requirements to notify the DOL as well prior to projects that involve abatement of ACM. How you go about removing it, you're setting up your controls, your work areas, your decontamination facilities. So there's different items in the NESHAP for that. Emission control, primarily, you know, the no visible emissions whenever you're doing any type of work with asbestos or other hazardous air pollutants. You don't want to see any visible emissions from a site. And then also the disposal end of how do you dispose of all that waste that is generated during abatement. OSHA, these are mainly your worker exposure criteria. So it's more of an employee type regulation, making sure that contractors or even owners of a building, they're responsible to have the safety of their employees, maintain that in a good standing condition. So making sure their employees have all the proper personal protective equipment, doing personal air monitoring, make sure they're below the permissible exposure limits that are established. And you know, if they do have to set up work area controls or site controls to limit exposure or prevent things from being released to the environment, that's all covered under that OSHA as well. On the New York State side of things, we have two primary agencies that lead the charge for asbestos regulations, that being the Department of Health and the Department of Labor. Department of Health is primarily focused in on the training side of things, and also on laboratory analysis. They have their environmental laboratory approval program that will each laboratory will apply for if they want to do asbestos related analysis. So, you know, any samples collected for New York State need to go through an ELAP approved laboratory that's approved through the Department of Health. And also the training programs all have to be, you know, individual training. So your workers, your bulk inspectors, designers, all that training is regulated through the Department of Health. Department of Labor, they take on pretty much everything else related to asbestos, so they are in control of the Code Rule 56 regulation that explains how we need to handle and manage asbestos in New York State, and also the enforcement. So if there's they'll do site visits during abatement projects, make sure everything is up to par. They'll issue the violations if they see things that aren't correct, and they may even visit normal construction sites that don't have active abatement if they feel there's a risk that someone's illegally removing asbestos. So they do have the enforcement to issue violations to contractors or owners that aren't even associated with asbestos abatement, aren't even certified or trained, because if they're doing work that they're not supposed to, and a licensed person's supposed to do. All right, so that brings us to question number 1.
All right, Cheyenne, you can continue.
Okay, question number 1 was, which of the following is not one of the EPA categories for asbestos-containing materials? Answer there is C, roofing materials. All right, back to the New York State regulations. Again, Code Rule 56, 12 NYCR Part 56 is our regulation here in New York State for asbestos-containing materials. You see the cover there on the right-hand side of the screen. The most recent revision was effective in 2007, so we had some prior iterations to that, and we are currently working off from the one that was revised in 2007. Few things with the Code Rule 56. There are some applicable variances that are included as part of, as attached via addendum there as part of this regulation. So those were scenarios that were so common that they decided, just to do it as an applicable variant. So anybody could use these. It's kind of like an extension of the regulations. Anybody could automatically use those without having to submit a formal petition. There are other ways to submit petitions for relief from Code Rule 56, and that's via a site-specific variance or blanket variances. Site-specific variances are the most common. They usually don't issue too many blanket variances, but basically what a site-specific variance allows you to do is petition the New York State Department of Labor and say, hey, we feel that these certain issues or scenarios are detrimental to the cause of the project, and there's significant hardship, whether it's financial, time, or they just can't possibly do something safely if they follow the regulations to a T. So that site-specific variance will allow them to get a little bit of relief from those protocol. It's good for the duration of the project. Usually, they usually have a set duration and an expiration date, but it's only suitable for that specific project. You can't take it from project to project and apply the same site-specific variance. You have to submit a new one each time for each different project. There's also a guidance document available that the Department of Labor prepared a while back that provides a little more clarification on the interpretations or the way the regulation is intended to be interpreted. So there's various questions in different sections of the Code Rule 56. So what they did was just compile those questions, those common questions, and put them in that guidance document. So that's pretty useful. If there are certain questions that you can rely on that and say, look, this is the way the regulators say it was intended to be interpreted. So kind of eliminates some of the gray areas of confusions that some people may have when reading the regulation. Some other additional revisions that have been discussed over the years, related to fire and life safety issues and other miscellaneous items. And there was a consideration of revising the code rule yet again, but that doesn't seem to have much traction as of late. So we're still working off that 2007 revision, and maybe someday in the future there will be a revised version to add in some other items they want to get in there. So different project types. The main thing we're dealing with on asbestos, most of the abatement projects in asbestos related work is associated with renovation or demolition projects. So a lot of surveys are done prior to renovations, demolitions to identify these asbestos materials. Then you go through a design process, abatement design to say, okay, here's where our materials are, identify any special considerations that need to be applied during that abatement process, and then through to the abatement and project monitoring, air sampling to make sure everything's clear and out of the way for other contractors to get in there afterwards and do their work. There's some other project types that have unique characteristics. One being a condemned building, so buildings that you can't access to either, generally you can't access to do a survey, so you're kind of assuming everything is asbestos materials, and you demo it in place with the assumption that everything is ACM. With that, you get a lot of relief from, obviously you don't have to set up established work areas. You got the entirety of the site as your work area and an exterior demo project. You keep things wet as you demo. You load into the dumpsters, and away it goes as regulated as best can material. So a lot less restrictions on the actual time and work activities on site, but you do have to dispose of that waste as the friable regulated asbestos contained materials. So a little bit costlier on the disposal side for those condemned buildings. Some special projects, you have implant operations. So this is a category that also allows quite a bit of relief from Code Rule 56 if you're doing it under implant operations. But there's some obstacles with that as well. You still need to have a satisfactory work area clearance, and that includes your visual and your air samples. So if you don't have an area under containment or certain sections of an area under containment during the work, in order to get air samples, you have to put it under containment. So a lot of times it becomes a little bit ineffective to do the implant operations. And then another category, incidental disturbance, and that's mainly if asbestos contained materials become disturbed prior to removal. So you have debris, you have areas that need to be cleaned up. With those, if you're a large or small project, you got to go to a site-specific variance to identify how you're going to clean those up and allow you to do that. Minor size project, those are minor size incidental disturbance, those are covered under the Code Rule 56 criteria, so you can clean those up without that variance. And then when I say the minor, small, large, you see on the slide here, your minor size project is anything less than or equal to 10 square foot or less than or equal to 25 linear feet of asbestos contained materials. Small is between 10 and 160 square foot, 25 and 260 linear feet, and then your large is anything greater than that or equal to the 160 square feet or the 260 linear feet. So going back to the incidental disturbance, as you can imagine, if you have disturbed material and you have debris, we have to look at the entirety of the contaminated area. So if you have debris on a floor surface, generally it's most likely going to be greater than 10 square foot that's affected. So when we talk about the incidental disturbances requiring a variance to do the cleanup, most of the time that's the case because you're probably in a small or a large category. To assess asbestos contained materials, we're either doing a full-on asbestos survey, and this is what you see for renovation, demolition type projects or significant repairs, or we can do some limited bulk sampling. And a lot of times we do limit surveys to specific areas that are going to be affected by a renovation project. We don't necessarily survey the entirety of a building if we're only doing, a wing or two of a building or a certain floor, or maybe just a roof repair project. So there are benefits, to doing either one of those. Obviously, with a bulk sampling event, it's going to be less costly. You're not sampling as many materials. It's not taking as much time. It's a smaller report. Whereas with a survey, you're doing a much more comprehensive assessment, and it might provide you with data that you could use for future projects. You might, if things haven't changed in certain areas, and you go to do a renovation project, you may use that data, to fulfill the assessment requirements or the survey requirements prior to renovation. Regardless of whether we're doing a survey or we're just doing direct to bulk sampling, it does have to be performed by a certified asbestos building inspector. New York State does require any asbestos sample to be a legitimate sample to be collected by a certified person. So, a homeowner can, if they want to go sample their own house and send it in for laboratory analysis, just to know, by all means that they can do that, and they can get a result for it, but they can't give that result to a contractor performing work in their house and say, look, we're negative for asbestos here. That, to be legitimate, it has to be done by that certified individual. So when we get to the abatement side of asbestos, there are some different areas as far as, doing oversight for the abatement work, and we categorize these as your air sampling and your project monitoring. So your air sampling, there is a certification for air sampling technician, and that's basically they're there to collect air samples. That's their main function. That's really, if you employ someone to do air sampling, that's all they're there to do, is collect those air samples. The project monitoring is the step above, where it's okay, we're monitoring what work activities are occurring to make sure that it is in compliance with the Code Rule 56 and other federal regulations. So it's a little bit more of a little bit more of a checks and balances with the contractor, that, okay, everything's being done, or, and we work, as a project monitor, you work with the contractor, say, okay, look, this is out of compliance, so let's get that fixed up, and all that. So it helps the project stay in compliance with all the regulations, and ideally, hopefully, when the New York State Department of Labor inspectors arrive on site, everything's up to snuff. Nobody's going to get a violation because you have those checks and balances there. So when you're kind of debating which one to choose and why, simple projects, small, real simple projects, maybe air monitoring, you're comfortable with that. When you get into the larger, more complex projects, or you just want to have someone on site because you can't enter the work area, you don't have the certifications and such to enter the work area, you can have that extra person in there to be able to provide feedback and input on how the project is progressing. When we get to the final stages of an abatement project, we're going to do some air, we would do clearance sampling analysis, and this always involves a visual. You always need to visually clear that the work that was set out to be done has been done, and there's no residual asbestos there in that area. And this includes, checking, dust in general. If there's any dust, unclean areas, they have to be recleaned. Make sure everything visually looks good before we go through the process of collecting air samples. Now, the air samples, it's going to be dependent on, not every project needs air samples, but generally when you're dealing with small and large size projects, we're going to be required to do air samples to clear that work area. And when we do that sampling, there's a couple different methods you can do for analysis. You see there the PCM and TM. The PCM, that means your phase contrast microscopy, and that's the common one that you do for final air clearances, unless you're dealing with a school project. So most abatement projects, we're doing PCM analysis. The thing with PCM is you're going to get, and it's going to tally, all fibers that are detected on that sampling cassette. So it's not going to differentiate between what might be asbestos fibers and what might be something different, whether, it's a cotton fibers or who knows what, polyester, whatever it is floating in the air. So if you have, possibly, an issue with elevated dust in an area, which you shouldn't, but if you do, that can overload a sample. you could get a bad result with that. And this could be, this could be possible, with your outside the work area air samples, which are the critical ones. If they're doing construction nearby and you got dusty conditions, that could really wreak havoc on your PCM air samples. So an alternative to that, and what is required for clearance in K through 12 schools, your transmission electron microscopy, and that will differentiate between asbestos fibers and others. So you know what you're getting, the result is asbestos fiber. So if you're high on that, you definitely have a problem. And we've seen scenarios where we fail on the PCM cassettes, either because they're overloaded or they're elevated. We go to the TM analysis and everything passes. So there's options there. A little more expensive, obviously, on the TM, but there's an option there to allow for, checking to see if it's really an issue or if it's just something to do with the PCM analysis. A couple things to be cognizant of is the timing of the sample collection. There's a set period of time you need to have analysis results back on site during an abatement project. So you want to make sure that, if you're collecting samples at the end of the day, it's, work is done in sufficient time so that you can get those samples and get them shipped out to the lab or delivered to the lab so we can have those results in a timely manner. And then the sample turnaround times, obviously, you want to make sure you're directing the lab to get a proper sample turnaround time there. All right, so that brings us to question number 2.
All right, Cheyenne, back to you.
Okay, question number 2. A minor size abatement project is defined by which of the following quantities of asbestos-containing materials? Answer there is D, the 10 square foot and 25 linear foot criteria. All right, so we'll move into lead now. Lead-based paint. So when we talk about lead-based paint, the definition via HUD and US EPA is anything 1 microgram per centimeter squared or 0.5% by weight or greater. So doesn't take a lot to be defined as lead-based paint, but that is the definition there by the EPA, and that's the protocol that the limit where you would go into requiring an abatement or a mitigation process, especially in child occupied targeted facilities. OSHA, similar to asbestos, we're looking at any detectable concentration of lead in paint. So if you do have lead in material, and it may not just be paint, you may have lead in caulk materials, you may have like lead flashing on a roof or lead solder, and we'll get into some different materials later. But anytime you're dealing with something that has lead in it, OSHA would say, make sure you're protecting the workers and your employees appropriately. So forms of lead contamination, the big one, on the residential side, the big one where we see, the abatement and such is the paint. So you, and not specifically necessarily the paint itself, if it's in intact, stable condition, but the dust or the paint chips that might have resulted from deterioration of that paint. So as you can imagine, if you have a lead dust issue from the paint, if that gets into your air handling system, your return supply then forces way into the supply side of things, you could have issues from the HVAC system having lead dust associated with it. The other big item is drinking water, lead in drinking water, and we've all probably heard about Flint, Michigan scenario. So when you have lead in pipes or the piping system for either it's a single family residence or an entire supply system from a water treatment perspective, you could have issues with lead there. So either the pipes or the solder on the pipes that supply drinking water, that can create a big mess in a hurry with the drinking water issues with lead. Different exposure pathways, similar to, asbestos, it has the inhalation hazard. But the big one that the primary concern is with children certainly is the ingestion hazard. So if they're, in adults as well, the big one is the ingestion. Primarily either, with children who are exploring, their surroundings, young ones that, might put different things in their mouth, might have the lead dust, or it might actually be, the lead paint chips themselves. So that's definitely a concern. On the other side, if you're working with lead materials, or you're in contact with lead containing materials, you get the lead dust on your hands. And then you're eating something, you have that contact there. So, good hygiene, washing before you eat, especially if you're working with these materials, always a plus. Make sure you limit that exposure. Third option there with exposure pathway is absorption through skin. This is a less common item. It's usually more attributed to workers in industrial settings that are handling materials that are lead or lead containing, and they may have a heightened risk for that absorption through the skin. So, proper PPE is definitely in their benefit for those job occupations. Some different health effects. I'm not going to go through too much of these in detail, but as you can see, lead can cause damage to a lot of your body organs and such. So pretty much every system is affected, from your central nervous system, reproductive system, your kidneys, your gastrointestinal tract. So depending on where things settle out, it could wreak havoc in your body for sure. Obviously, sensitive receptors, children 6 years of age and under, and unborn children. So this population is still developing. A lot of those systems are, all those systems are still under development. So you can imagine if those are affected at a young age, and it stunts the development, affects the development, and it can cause more serious harm to them than it would on a healthy adult. Different federal regulations, HUD, they primarily have the guidelines that dictate what you do for the control and management of lead-based paint, specifically in those child-occupied, federally owned or assisted housing. So if you're doing any work in there, you follow those guidelines. But outside of work from there, those guidelines are useful to follow, even in the non-regulated or types of facilities that are from HUD. They're very helpful. They've got a large amount of information that's useful to apply, to other buildings as well. The EPA, their regulations requirements are pretty similar to what HUD has out there. And again, they're looking at target housing, child occupied facilities. So those are when EPA regulations kick in. So you may not necessarily, your facility may not necessarily fall under those categories, but again, it's always good to make sure that you have a clean environment, and you're doing things appropriately so you can manage your own hazards and mitigate any lead concerns that occupants might have or someone visiting your facility might have. EPA also has training requirements, so there's certifications similar to what we have on the asbestos side of things for state certifications. EPA has some federal certifications for lead abatement supervisor, worker, risk assessors, and inspectors. So in order to work on the EPA regulated type projects, you would have to have those certifications for the lead-based paint. OSHA, again, worker exposures, so employer making regulations, make sure employees are taking care of their employees. There are action levels and permissible exposure limits. The action level set at 30 micrograms per cubic meter, and your permissible exposure limit set at 50. So when you hit the action level, there's certain protocol you got to follow to try to reduce the exposure. You don't necessarily have to stop work, but you can continue on implement certain things, try to get that exposure back down. Permissible exposure limits where you kind of like, okay, we got to shut things down and figure this out, or we got to make sure everything, we got proper respiratory protection to do the work appropriately and keep yourself below that PEL. There's some state, New York State has some information. Again, they're going to be pretty similar to what the federal requirements spell out there. So their guidance, you'll see a lot of similarities with what the EPA would be looking to have done for lead-based paint management. On the abatement renovation side, there's 3 different ways that you deal with lead on the abatement or mitigation side, and that's either you do it through removal, which is obviously the most effective. You get rid of the problem, but it's also probably going to be the most costly. A couple other things you could do is the encapsulation or enclosure, and this is similar to asbestos. You can encapsulate and enclose these types of hazardous materials so that you eliminate the risk of exposure to occupants in the building, or you significantly reduce it. Enclosure would be, you're putting up a hard wall system, you're putting up a ceiling below, a fixed ceiling below, existing ceiling that has lead paint all over it. So basically you're closing off that issue. Encapsulation is more of apply a surface encapsulant or coating to that painted surface to keep it locked down, to keep the dust down. And again, you're significantly reducing those exposures. The thing with a big difference on enclosure and encapsulation versus removal is once removal is done, you're good to go. Do whatever you want in the building. You don't have a lead hazard issue. Encapsulation and enclosure, you still have a potential lead hazard issue, so you got to continue to do inspections on those surfaces or those enclosed areas to make sure that's doing the trick and that the exposure is not there. So it's a long-term monitoring thing that you do need to follow up with on encapsulation, exposure, and enclosure. On disposal side, mainly you're looking at, okay, when we get lead containing waste, are we dealing with hazardous or are we dealing with non-hazardous waste? To do that, we would collect a representative sample of the waste, send it in for analysis for the toxicity characteristic leaching procedure. And if it comes back above 5, it would have to be dealt with as hazardous waste. If it's below 5, it would be non-hazardous. So most non-hazardous landfills or C&D waste facilities can accept that. Clearance requirements. The main thing with again, you got to have a good visual. Got to make sure there's no dust there. If there is, re-clean it before you do your sampling. On the lead, the visual or the clearance sampling is done through wipe samples. So you're taking wipe samples from floors, window troughs, window sills, and you're comparing them to a standard. So you got to be below a certain level in order to meet satisfactory clearance. If it doesn't, then you got to do the re-cleans, retest, and ideally get it down to below those levels. So some different things to take into consideration for lead, inspections versus risk assessments. Not going too much detail with that, but basically your inspection is a surface by surface sampling of suspect lead containing paint. So you have the data, this is lead paint, this is not. Whereas your risk assessment goes in and says, okay, what's the hazards? Where are the lead hazards? We may not necessarily test all the paint surfaces for lead, but we're going to look at high risk exposure areas, what is accessible to children, the sensitive population, maybe something above a suspended ceiling, maybe a ceiling coated with lead paint above a suspended ceiling is not a high risk. So in the risk assessment, you're like, yeah, there's probably lead paint up there, but it's not a big concern right now. We're identifying in the risk assessment what those big concerns are and addressing those in a timely manner. Talked about the TCLP sample analysis, personal air sampling, medical monitoring. So that's the OSHA criteria to make sure the workers are protected and being monitored. And we also talked about that clearance dust sampling. There's also some soil sampling. So if you're doing exterior work or if you have bare yard areas, soil sampling is done for those. You got to be below a certain level again to make sure it's passing satisfactory clearance. So there may need to be soil removal during a lead paint remediation project. All right, now we have question number 3.
Cheyenne, you can continue.
Question 3, how did EPA define lead-based paint as containing what percentage of lead? The answer there is C, 0.5% lead by weight or greater. All right, lastly, we're going to go through some things about mold. Mold, you see Webster's definition there. Fungus, superficial growth on different decaying organic matter. Basically it's ubiquitous. You're going to find it everywhere. You're going to find it in an outdoor environment. You're going to find it indoors in airborne spores. Every sample we collect, whether it's indoors or outdoors, if we're doing air sampling, it shows up with some sort of mold spore there. You're not going to avoid it. The main thing is you don't want to subject people to a significant amount, a crazy amount of. So, you're going to have algae outdoors. You can't really control the amount that's coming in from outdoors, and allergic reactions that might occur with that. But you can obviously control growth on building materials inside the building so that you don't have added exposure to mold and kind of reach those thresholds where it may start affecting people. There are some common types of mold. I don't get too much into detail on what the types are. There's some that take a little bit more of a moisture water issue to grow. There's some that are grow pretty quickly. But the main thing we're looking at, okay, is do you have significantly more mold issue inside than outside, and that could present a problem to the building occupants. Mold does require food and a moisture source, but once it has started growing, so obviously you need moisture, you need damp conditions, and this could be humidity, this could be actual water on the surface. But if it has a good food source, your cellulose materials, your gypsum board, carpet, things like that, it can start growing pretty easily there. But again, once it does start growing, it doesn't necessarily need moisture and water to keep growing. Certain molds are pretty hardy and they can feed off from themselves or other molds, or just continue feeding off that food source. So, it is important to remove the moisture and water issue, but you still got to make sure you remove all the mold affected materials, because they can continue to grow without that moisture source after that. There is a cause for concern. I mean, it's it came out pretty prevalent there in the early 2000s and continues to be a big concern with different with buildings and such. Big things are, we do have our construction methods are a lot more geared towards energy efficiency, having buildings more tightly sealed up. So, older buildings, you may not really have an issue with mold because you have good drafts through them. It's not good for energy efficiency, but you got that good indoor-outdoor air interaction and keeps your mold issues at bay. Whereas your newer buildings, you tighten those up, you seal them up nice and good, and then when you have a little bit of moisture or water issue, you more quickly get a mold issue. So that's a big thing there. And another reason for recent concern in the last couple of decades is we're, in general, we're more conscious of these different types of pollutants with asbestos, lead, all these different things that we know now have harmful effects to us. And mold is one of those other things that's like, okay, that could harm us, that could have detrimental health effects. So definitely on the alert for that. Health concerns, obviously, mold is going to be your respiratory type system mostly. Ingestion could also be an issue, but mostly it's the inhalation where we have the allergic reactions, and it's going to affect different people in different ways. People that are more susceptible to respiratory types of infections, they may be hit harder than others. So you may have people in the same building, and certain people are, have allergic reactions that are attributed to mold, and other people are just fine. That's the nature of the differences in people and their threshold to mold exposure. In New York State, the DOL heads up the mold legislation, Article 32 of the labor law. So that talks about, basically that describes what's required for training and licensing on mold specific projects. And it also defines minimum work standards, but it doesn't go into detail about, the specific methods or the specific containment, things you would see in Code Rule 56 where it says, well, you gotta have a containment that's a minimum of this size, minimum of, one shower, all this and that. Our mold legislation does not get into that. So that's left up to, the assessor and the remediation contractor to develop those work plans to make sure that things are done in a satisfactory condition. Different trainings and qualifications. There's a mold assessor, mold remediation contractor, mold abatement worker. Those are the 3 certifications we have in New York State. And then I put up here the definition of the mold of mold remediation of a project that's in our Article 32 of the New York State labor law. So what it says is mold remediation assessment or abatement of areas greater than 10 square feet, but does not include routine cleaning, construction, maintenance, repair, or demolition of building structures or fixtures undertaken for purposes other than mold remediation or mold abatement. So these mold legislation is specific for when a building owner or homeowner is calling to have someone do a mold assessment or remediate the mold. If it's part of a renovation project, it does not apply. You can renovate, you can remove the mold during the renovation. You don't necessarily need to apply this, but you could obviously require, it's really up to the building owner if they want to require someone certified and licensed to do mold remediation, regardless of whether it's a renovation project or specific to the mold. There are various other useful standards, guidelines, OSHA, EPA, some different ones there that you see that you can rely on for guidance on mold abatement. All right, so question number 4.
Cheyenne, you can continue.
Question 4, which of the following is not specifically described in the New York State mold program, Article 32 of the labor law? And the answer there is B, mold remediation methods. So it does give us minimum work standards, training and licensing, but it doesn't dictate the methods that need to be applied. All right, so mold assessment, what we do on mold assessment. So according to the New York State legislation, the essence of a mold assessment is to develop a mold remediation plan. And what we need in that mold remediation plan is listed here. We have to identify the rooms and the areas of work, quantities, methods that should be used during the mold remediation, personal protective equipment, whether it's, comment on the contractor selecting the appropriate ones, or, it's actually specifying, you would note that. Clearance criteria, that's a big one. You want to make sure that everyone is aware of how the area is going to be cleared after the work is complete. You can't complete the work and then decide how you want to clear it. It's got to be specified up front. Notifications and non-occupied buildings. So are we, how we do notifications, there's no set requirements to notify, but it is important, that occupants, do know that there is a mold remediation project. So how do you go about doing that? Is it, you verbally communicating that, or we putting postings on doors, things like that. Also, the legislation requires an estimate of remediation cost and time frame. So this gives the owner an idea what they should expect to see when they get in touch with a remediation contractor. So are they way off the estimate, or are they, within reason? So that gives them a better idea, so they're not going to basically be frauded, with an outrageous number and timeline. And then the underlying source of moisture. So the intent of an assessment isn't to identify specifically how to remedy a moisture water issue, but if you can identify the underlying source and provide recommendations to the type of contractor, or if you need to get in touch with an architect or a designer, structural designer, something to that effect, where they can say, okay, yeah, you've got issues with your roof. This is how we can go about fixing it. That's not part of the mold assessment, but try to help the owner out, provide those recommendations if you can. Investigate and sample mold. Generally, the main thing when we do assessment, you have to do a visual. So you're visually assessing these areas. Ideally, you can get to, areas behind walls, but that's not necessarily always the case. So, you might be limited to things that are visually exposed. But there's also some other things. You can use a moisture meter. You could use borescopes to get behind surfaces. You could do bulk samplings, air sampling. It's not necessarily recommended or required, but if it's something you want to do, that could be added into the assessment. Mold remediation, you want to do pursuant to the mold remediation plan, which is prepared by the mold assessor. The mold remediation contractor would take that and they develop a mold remediation work plan. So usually that mold remediation work plan mirrors what is said in the mold remediation plan. So this is kind of a checks and balances, that this is what the assessor recommends doing for the mold remediation. The contractor understands it because they put it in their work plan. And so at the end of the day, that's what should be done, and that's what needs to be done in order to get satisfactory work area completion and clearance. Things to consider for mold remediation methods: you want to look at the type and size, type and damage of materials affected. Is it something that we can easily remove and be done with the issue, or we're talking structural supports where we can't necessarily just go remove wood framing. We might have to try to treat it in place to the best of our ability, whether it's an antimicrobial agent and then trying to follow up with a sealant to limit further mold growth, or things like that. So sometimes with materials that can't be removed, you got to get a little bit creative and figure out what the best approach is to address those. You also want to take into consider the size of the area, the source of the moisture, whether the building is being used, occupied. Can you just go in there and rip through it and get it done, or do you have to take special precautions, limit your work areas and build containments and all that? Some different prevention and control methods. Number one, water source. Make sure you mitigate water sources immediately. Make sure you clean and dry materials quickly. You might have to control humidity, increase air movement, prevent condensation, things like that. Take care of your issue before they start creating a mold problem. All right, and that brings us to our last question.
Cheyenne, you can continue.
All right, question 5, true or false? New York State mold program requires a mold remediation work plan for all projects where mold is discovered. That is false. All right, just a couple more things to wrap up here. We welcome your feedback regarding this or any ATL webinar. There is a a link there that you can go to and share any feedback, input, comments, suggestions or questions that you may have. We welcome that. And also we have another